The focus of this video is on supporting communication when you are engaging in a conversation or communication exchange with people with aphasia and/or apraxia of speech. Let's begin by digging into the question of what is aphasia. Aphasia is a language disorder that impacts a person's ability to say the words, phrases, and/or sentences that they want to say. It may, not always, it may also impact their ability to understand what others are saying. We refer to that as understanding spoken language or language comprehension. We also sometimes call that receptive language. It may also impact, in some cases, reading and writing skills. So overall, aphasia can affect a person's speaking, understanding, writing, and reading. However, it's important to know that despite a person's communication ability that may change, they are the same person they always were. It's just their ability to communicate that has changed. And finally, most people with aphasia benefit from some sort of approach that focuses on communication as opposed to speech and language alone. So a total communication approach is often effective, and that may include things like drawing or writing, typing, pointing, gestures, and/or facial expressions, to name a few. These days, almost everyone has a phone in their hand all the time. A lot of people with aphasia will use their phone to help them communicate, either to replace the words or supplement their communication to enhance or improve their message. Now, aphasia, it's important to also think about what it is not. Aphasia is not a loss of intelligence. It is not a loss of intellect or cognitive ability. It is a disruption in using and/or understanding language. People with communication disorders commonly experience social isolation, sadness, and/or frustration, to name a few. Why is that? If you think about the role speaking and communication in general plays in your day-to-day life, and then imagine that you suddenly either lose that ability or have great difficulty in one of those areas, you can only imagine what that might feel like. So going to the grocery store to get a loaf of bread and a gallon of milk becomes a great challenge if you don't know where everything is. So the idea that you'd have to ask a question in a grocery store for something simple but couldn't say the words you want would definitely make a person nervous or have a little trepidation about getting out there into the world again. That's why social isolation is such a risk for people with aphasia. And it's important as caregivers and/or family members that you understand that risk so you can hopefully facilitate successful communication with your family or caregiver and reduce that risk of social isolation and sadness and/or frustration on your part as well as the person with aphasia. So now let's talk about what is apraxia of speech. Apraxia, different than aphasia, is a motor planning problem. So if I explain to you how we actually produce speech, then we can identify and understand what apraxia of speech is and where that breakdown occurs. So for you to just say any word, one word, like for example, cat. You have a word in your head and you want to say the word cat. Your brain then takes that word, breaks it down into the little bits, which are the sounds. And so in other words, k, a, t, and then plans the muscle movements needed to produce those speech sounds. So it plans the movements, sends those motor programs to the little muscles all in your mouth and your throat and your breathing and all of that. And then those muscles in your mouth create the speech sounds that are a part of each word, and lo and behold, you are talking and producing speech. All of that happens in a hot second, not even, in a little millisecond. So with apraxia then, that is when the person knows what they want to say, but if you look at that green section above, they have difficulty with the planning of those muscle movements. So they know what they want to say, but they can't get the muscles to do what they want because the motor planning is disrupted. So one of the things that's challenging for people with apraxia of speech, beyond the fact that they have this difficulty, is that sometimes the harder they try, the worse it gets. It's not always the case, but can certainly be that way. And if they're really being pressured for time, that can make speech harder. So you might note that people with apraxia of speech have automatic speech that comes out pretty well. So when they're not thinking about it and they just quickly answer without a lot of thought, their speech is better. Then if they try to initiate speech, the harder they want to get those muscles to move and the harder they think about it, the worse it gets. So as you can imagine, that's important for you to know so that you're not creating an environment that actually causes them to have speech that's worse as opposed to better. So as we're thinking about how to communicate with someone with a communication disorder, such as aphasia and or apraxia of speech, we want to be sure that we have a communication-focused mindset as we engage with these folks. We want to be respectful. We want to have time to engage effectively with them. And we want to provide multiple opportunities and ways for them to communicate and for us to communicate effectively with them. One size does not fit all when it comes to people with any communication disorder, but particularly in this case, we're talking about aphasia and apraxia of speech. So do talk to them in adult language, but if they do have trouble understanding spoken language, which as I mentioned, that's not everyone, but if they do have difficulty, it might be beneficial to talk with them in sentences that are a little bit shorter. We want to give them plenty of time to respond. That way they have time to decode what they're hearing, to try to get the language comprehension kicking in, but also figure out what they do want to say as a response. So that will help their expressive and receptive language. We want to encourage them to use any means necessary to communicate. They can write, gesture, point, show, draw, use their iPad, use a phone, type an answer, point to pictures. And you can also do the same. If they're having difficulty understanding, you don't just have to speak. You can add additional modalities or alternative ways of communicating. And additionally, keep an eye on their facial expressions and body language. We learn a lot from one another about our facial expression and our body language. We do a lot of communicating that way beyond the words themselves. What to avoid? Do not start a conversation with a person with aphasia if you're in a hurry, if you don't have time to actually spend making sure that you are effective and give them what they need to be effective communicators, then that's not the time to have the conversation. Avoid speaking down to them or in a childlike way. Avoid rushing them or asking them lots of high pressure questions, or some people will say, I don't know why they don't just say what they want to say. That's also not effective. As you can imagine, if you have aphasia, that might make you feel kind of bad, right? So we don't want to do that either. And never assume people don't understand you just because they have difficulty verbally expressing themselves. Sometimes people have difficulty expressing, but their understanding is perfectly fine, particularly when it comes to that apraxia of speech. Helping them understand spoken language is going to be one of the most important things you can do when you are working with someone who has difficulty understanding what other people are saying. So we want to try to make the message easier to process without talking down to a person. So how can we do that? As we mentioned or alluded to, we want to slow down. Our society moves at a really fast pace. I'm a fast talker, as you might have noticed, and when I'm working with my clients, the first thing I do is slow myself down. Additionally, I pause between ideas or components of sentences that are important. I will simplify a little bit and use clearer, more direct wording. If I notice that the person is having difficulty understanding, because I'm looking at their face and they're making a face that tells me, wow, they don't get it, or perhaps they're shaking their head that they don't get it, I'm not just going to keep repeating the same thing over and over. I may repeat if they want me to, or if I know that works, maybe one time. And then if they still don't get it, I'm going to work on rephrasing it. I don't want them to stay stuck, so I'm going to say things in a different way. This benefits all of us. We've all had that experience, I'm sure, if you think back. And it's so much better when someone just restates it and then you go, oh, now I get it. If you are need to convey information that's kind of complex and multi-level, then try to break it down into one step or component at a time, instead of giving it all in one big lengthy explanation or, a sentence. And then finally, in order to decrease the risk or impact of communication breakdowns, when we do get to the point we think we've got an understanding, we want to confirm that. Typically, you can do that by asking a yes/no question to check the understanding of that person. And we'll talk a little bit how to do that on another slide. Now let's think about how we might help a person with aphasia communicate their message effectively. We know that people with aphasia and apraxia of speech have difficulty getting the words out, right? So whether it's a problem at the word level with aphasia or the motor planning for speech, the word that they want to say is not coming out. So we're not going to say, hey, don't talk. We are always going to encourage speech. But in addition to speech, we can encourage other modes of communication, such as writing, typing, pointing, gesturing, drawing, showing, looking at pictures in their photo album, searching on the internet, using an iPad or a phone or a laptop, writing down or referring to lists of words in notebooks, etc. There are so many different ways that people can communicate, and when a person has aphasia, this can really be what opens things up for them, as opposed to limiting them by the words that they can get out of their mouth. We communicate in all sorts of different ways. So if you have someone and they have a phone or an iPad, encourage them to utilize that. Encourage them to have a notebook ready to write or type as needed. And you're going to be very open and encouraging of that as a communication approach, versus us trying to sort of force people to talk only with words. So we want to be really encouraging and reinforcing of those positive behaviors of writing, pointing, gestures, and also you paying attention to those and possibly you utilizing those to help you communicate at times as well. One question that often comes up is, well, gee, if they have difficulty writing and typing and or reading, then why would you encourage those modalities? Well, the answer is, even if you get a little bit of a word, that will help you understand what word they're trying to say, because it narrows the choices of words from all the words in the universe to perhaps only words that start with BA. And you may also have further context that makes that communication exchange very, very clear with just a little bit more information. So sometimes alphabet boards are also great. You'll see all these different modalities, and encouraging that person to communicate in whatever way works for them is what really counts, because at the end of the day, we really want to understand what they're telling us, and we want them to understand us, and that can occur in ways other than just the words we utilize or the words we understand. Now let's assume we've had a really clear communication using any means necessary, and now we as communication partners want to clarify and confirm that we have received the correct message from our person, our friend, our family member, or the person we care for with aphasia or apraxia of speech. So we're going to check understanding. We can do that through a few different ways. And why are we doing this? Because if we are not on the same page, we need to know, otherwise frustrations can build, and we really want to mitigate the frustration and support effective communication. So we have a few really simple options we can rely on. One is we can simply ask yes/no questions to validate that what we are, where we're at in terms of our understanding, is correct, and ask them to say yes or no, or perhaps nod their head yes or no, or point to yes or no as an answer, depending on how they communicate. And it can be as simple as asking a really direct question like, do you want coffee? Because we've arrived at that through our other communication exchange, and then we're getting final validation before bringing them coffee. If that's not an option for folks for reasons such as difficulty understanding language, then you can have them show you some options and have them choose from those options once you know we're all on the same page, and definitively gesture and or point to what they're communicating. And a final way that we can think about that is to just confirm that what you think is what they meant. So that is great if someone's trying to express something a little more complex that might have a little more subtlety to it. So for example, we might say, I think you're saying you want to call Bob. Is that right? And if they then said yes, then you're good to go. However, if they say no, you can ask for clarification. And in this case, they might point to you and then the phone, which might convey that they want you to call Bob as opposed to them calling Bob. So that would be a really subtle difference and a little bit of a really important clarification, but that's where we get into the nitty-gritty of communication. So we had the greater context, but we then want to clarify the specifics. So that you can do through saying it back and getting confirmation. So a person with aphasia and or apraxia will benefit from having communication exchanges on a daily basis and engaging in daily therapeutic practice. The daily practice will probably be recommended and provided by their speech language pathologist, and this may include things like recorded speech practice, typing practice, reading practice, etc. And all of these may be separate activities, or they may be combined into an activity that really incorporates multiple modalities. For example, we may have a paragraph that they're going to practice reading aloud. That way they're working on the reading and the speaking at the same time. And then they might sit down and take that same passage and type it to practice that non-spoken language production, so their typing and spelling can also be improved or maintained over time. And the other area that's really important for people is to engage in communication on a daily basis so that they get practice with that communication. So having a person be able to come to you and have a conversation, initiate conversation, or talk while they're engaging in activities of daily living. So encouraging them to communicate their choices rather than just giving them what you think they want. So being patient during those exchanges, encouraging the use of their iPad or paper to communicate, giving them feedback when they do something that's really helpful, give them feedback during those communication exchanges. So if they, for example, create a drawing that really helped you understand exactly what they wanted, then let them know how helpful that was. Wow, that drawing really was helpful. That was great. Thank you so much. Give them choices. So don't just assume. Encourage them to communicate what they want instead of being passive participants in their daily activity and daily living. And then remember, when we are doing that in daily activities, we still want to circle back and make sure that we are validating that what they communicated is what they really intended to communicate. But the overall goal is to reinforce and support successful communication and not necessarily speech itself or perfect speech. We want to encourage practice, but do so in a relaxed and supportive way. Finally, as a quick reference, here is a link to learn more about the life participation approach to aphasia, which is very person-centered, but also has amazing training activities for caregivers and family members. So the website is aphasiaaccess.org, and the link here is just to give you a little information about the LPAA, which is the life participation approach to aphasia. And finally, just a review. When we're engaging and we want someone to understand us as much as possible, because maybe they have difficulty understanding language, We need to slow down, use clear adult language in shorter sentences or phrases or parts. We want to rephrase instead of simply repeating over and over. We want to break items, directions, or instructions down into smaller steps or bites of information. And to facilitate their expression and you making sure you're confirming what they are trying to say is accurate, you can ask them yes/no questions to verify understanding. You can encourage them to use writing, typing, pointing, gestures, showing you, etc. Use any means necessary, encourage them to do so. And finally, before you assume the communication exchange was effective, say it back to them and ask them if you are correct and you are getting what they're saying before you then just move on with a communication breakdown. All in all, I hope this presentation gives you something to think about in terms of facilitating effective communication for people with aphasia and/or apraxia of speech.